Emotional viral news. Trump administration abruptly cuts billions from state health services. In a move that has sent shockwaves across the United States, the Trump administration recently announced an abrupt decision to cut over $12 billion in federal grants earmarked for critical state health services. These funds were instrumental in supporting programs aimed at tracking infectious diseases, providing mental health care, and addressing public health emergencies. The sudden withdrawal of financial support has sparked outrage among healthcare professionals, state governments, advocacy groups, and citizens alike. The slashed funding was being utilized by states to combat pressing issues such as opioid addiction, HIV/AIDS prevention, maternal health initiatives, and vaccination campaigns. For example, many state-level disease surveillance systems relied on these grants to monitor outbreaks like COVID-19 or seasonal flu. Mental health clinics serving low-income communities are now facing potential closures due to budget shortfalls. Advocates warn that this drastic reduction will disproportionately affect vulnerable populations, including children, the elderly, and marginalized groups who rely heavily on publicly funded programs. Families who depend on free or subsidized mental health counseling have expressed fear about losing access to life-saving resources. Parents worry about their kids missing routine vaccinations, while rural hospitals, already struggling with limited resources, wonder how they will cope without additional federal aid. Public health experts argue that the timing of these cuts could not be worse, given the ongoing challenges posed by pandemics and other medical crises. Critics of the decision claim it reflects misplaced priorities within the administration, accusing officials of neglecting long-term public health needs in favor of immediate cost savings. Others see this as part of a broader effort to dismantle government-funded social safety nets. Supporters of the cuts, however, argue that reallocating funds can lead to more efficient spending and encourage private sector involvement in healthcare delivery. This controversial policy shift has ignited fierce debates on social media platforms, where hashtags like #SaveOurHealthcare and #PublicHealthCrisis have gone viral. Stories of individuals impacted by the cuts, such as parents unable to afford therapy for their autistic child or seniors skipping medications due to rising costs, are flooding timelines, amplifying the emotional resonance of the issue. Many Americans feel betrayed, believing that public health should remain a priority regardless of political affiliations. As the nation grapples with the implications of this decision, there is growing pressure on Congress to intervene and restore funding before irreparable damage occurs. Until then, countless lives hang in the balance, underscoring the urgent need for accountability and action from policymakers. Conclusion: the decision to slash billions from state health services has struck a nerve across America, highlighting deep divisions over the role of government in safeguarding public welfare. While some defend the cuts as necessary fiscal measures, others view them as reckless and harmful. As discussions continue, it remains crucial for citizens to stay informed and advocate for policies that prioritize human well-being above all else. These elements will help your video rank higher on YouTube searches and attract viewers who are emotionally invested in the topic. The title is designed to evoke curiosity and concern, while the keywords and hashtags ensure discoverability across platforms. Please like, subscribe, share, and comment. Quiz: understanding the impact of budget cuts on public health instructions. Read each question carefully and select the correct answer: A, B, C, or D. Only one option per question is correct. What is that? Find out. 1. What was the total amount of federal grant money cut from state health services? A, $5 billion. B, $10 billion. C, $12 billion. D, $15 billion. Tab 2. Which area of public health was not directly affected by the funding cuts? A, tracking infectious diseases. B, mental health services. C, disaster relief operations. D, space exploration research. 3. How might the cuts impact vaccination efforts nationwide? A. Increase vaccine production. B. Improve distribution efficiency. C. Have no significant effect. D. Reduce availability of vaccines. 4. Who is most likely to suffer the greatest consequences of these budget reductions? A. Wealthy urban residents. B. Large corporations. C. Low-income families and marginalized communities. D. Foreign tourists. 5. Why do critics believe the timing of the cuts is problematic? A. Because it coincides with tax season. B. Due to upcoming elections. C. Because of ongoing pandemics and health crises. D. To avoid scrutiny during holidays. 6. What argument do supporters of the cuts make? A. They argue the cuts will increase taxes. B. They claim the cuts will promote efficiency and private investment. C. They say the cuts will improve public trust. D. They insist the cuts will eliminate corruption. 7. What hashtag became popular online following the announcement of the cuts? A. Hashtag stop vaccines. B. What raise taxes? Save our healthcare. D. Hashtag privatize everything. 8. According to advocates, what could happen to rural hospitals if funding isn't restored? A. They may expand rapidly. B. They will become fully digital. C. They risk closing down entirely. D. They'll receive international funding. 9. What type of stories went viral on social media after the cuts were announced? A. Celebrity gossip. B. Sports highlights. C. Stock market updates. D. Personal accounts of individuals losing healthcare access. 10. What is the primary demand of those opposing the cuts? A. Lower taxes. B. Privatization of all healthcare. C. Restoration of federal funding for public health programs. D. Reduction in government oversight. Please like, subscribe, share, and comment.